Good morning, my dear friends and fellow colleagues. This is Dr.Sepuri Krishna Mohan, Endocrinologist, Kurnool. Hope you are doing fine. And I just wanted to give you some message during this dreadful pandemic, what the world is going through. So, my dear fellow colleagues, doctors, before protecting the patients, first protect yourself by wearing a mask. If possible, you go for a triple mask if it is not at least, if not N95 or N100. At least a triple mask and gloves will serve the purpose to some extent. Take care of yourself so that you'll be able to take care of the patient in a much better way. And what is more required in this dreadful pandemic is I just want to talk about the vulnerable patients. That is the most vulnerable patients, being the elderly patients suffering from diabetes and hypertension and the cardiovascular diseases and the malignancies and the smokers and the chronic pulmonary diseases like chronic obstructive pulmonary disease, COPD or COAD, chronic obstructive airway disease, or the COLD, the chronic obstructive lung disease. One and all are everything is same. And the patients who do smoke, and the patients who suffer from malignancy actually, and the patients on this particular chemotherapy or radiotherapy, and the patients who are on this corticosteroid therapy, that is immunocompromised patients, in fact. So these are the subsets of patients where they are more vulnerable to this particular dreadful pandemic, and the mortality and the morbidity drastically rises in these patients. So if we can take care of your patients, per se, I am going to concentrate today on diabetes. If we can take care of the your patients suffering from either T1DM or T2DM or T2DM in the young or even the GDM, and the secondary types of diabetes. And if you can see to that the HbA1c is to the target and the fasting is to the target, like it is 80 to 130, and the random or casual plasma glucose, or even the 2 hour post lunch or post breakfast or whatever it may be, post dinner, you see to that it is below 180 milligrams per deciliter as per the recommendations, and an A1C of less than 7, at least 6.5 to 7, at least in the very intensive control group, like the patients with no risk of hypoglycemia. Then I think it will be a nice job done for this particular patient suffering from diabetes. So now I just get into the topic. And so stay safe and stay healthy. This is my take-home message to all my professional colleagues. And today we have the patient with diabetes who are worried about their health because of the prevailing challenging situation. As our patients are advised to stay at home, it becomes even more important to keep them aware and engaged in the disease management. Therefore, there is a need to discuss with them the importance of diabetes and self-care behaviors to control their blood glucose levels. And the vast majority of day-to-day care in diabetes needs to be handled by the patients only, because they are only supposed to manage their disease, because they cannot come to the hospitals and we will not be able to treat them, or we can only help them over phone. And the families, who are cooperating the patient in all regards, with regards to diet, with regards to giving the medicines and all. Hence, there is an importance of need for us to create awareness and diabetes self-care monitoring among the patients as well as the caregivers also. That is the family members. And this is the theme of the IDF also. The diabetes and the cooperation of the family members. This was the theme for 2019, the IDF theme actually. So the AAD has recommended 7 self-care behaviors for the management of diabetes, which can be used as a ready reference to increase awareness on the disease management. There are healthy. The following are the 7 points. Like one is healthy eating, and the second is regular exercise, and the third is frequent monitoring of blood glucose levels. That is the home glucose, the glucometer monitoring, and the fourth is the medical adherence, and the fifth is the problem saving skills, and the sixth is the reduction of the risk, and the seventh is healthy coping. The ADA, the American Diabetes Association, recommended diabetes self management and continuum explains the link between the learning and behavioral changes to the clinical and long term outcomes. So all the 7 behaviors have been found to be positively correlated with good glycemic control, reduction of complications, and improvement in quality of life. That's what I said in my this thing. If you can reasonably maintain the patient's HbA1c below 7, and the fasting target between 80 and 130 milligrams per deciliter, and the 2 hour post lunch or post glucose or post breakfast, post dinner, or any time the random, that is the casual blood sugar below 180 milligram of deciliter, the patients suffering from diabetes are less vulnerable to get into this dreadful pandemic, and thereby they can reduce the mortality as well as the morbidity also. So also you are aware, a systemic review conducted in 22 randomized clinical trials showed an average of A1C reduction in 1.1 in patients following the diabetes self-care. So through this video, I appeal to all of you to keep to help your patients understand the importance of diabetes self-care, to bring back the HbA1c control, avoid any short-term complications. Usually the short-term complications will be hypoglycemia or the abnormal hyperglycemia. So we need to educate them regarding this, and how to counter hypoglycemia, how to make a diagnosis, self-diagnosis of hypoglycemia, and what are the measures to be taken in grade 1 hypoglycemia, grade 2 hypoglycemia, and grade 3 hypoglycemia. And in case of hyperglycemia, we must be able to help them over phone to increase the dose of insulin, or even increase the dose of the tablets, as even the exercise is not possible, going outside is prohibited. The patients are advised, all the people, not patients, all Indians are advised to stay at home, stay safe, as our honorable Prime Minister Mr. Narendra Modi yesterday also announced that the lockdown is been extended until 3rd May of 2020. So you encourage your patients to go for a hand exercise and a leg exercise at least for 15 minutes each in the morning and 15 minutes each in the evening, so that it becomes half an hour in the morning and half an hour in the evening, so that they better achieve their glycemic target, like the A1C and the fasting and the posting and the random, whatever it may be. At any point, the 7-point formula of monitoring should be like to the target, to lessen the morbidity as well as the mortality. And the core message I would like to give is that the diabetes monitoring should be in such a way that the patient should keep their blood sugars to the target, to escape from this particular dreadful pandemic. I repeat once again, maintain the A1C, maintain the fasting, and maintain the post lunch. Maintain before that, maintain the exercise in the home itself, and a reasonably nutritious, healthy diet, which includes a lot of vegetables and leafy vegetables, dal, eggs, and the fruits and all, the cereals and the pulses. And the next only is the drugs. The first is exercise, the second is the diet, and the drugs, they come in the last. Ask them not to skip even a single tablet as you have prescribed. And through this video, I appeal to all of you to help your patients understand the importance of diabetes self-care to bring back HbA1c control and avoid any short-term complications and empower patients with the right knowledge, tools and diabetes self-care. And in this context, I would like to tell you once again, all the time remember our traditional namaste. All the time, never go for or totally discourage or abandon the shake hands or the handshakes, whatever it may be, and keep personalizing. And all the time, you be safe first, so that you can save your patients. This is my message to you. And with a humble namaste, I conclude my session. Namaste.